Good morning and welcome. My name is Simone Johnson, Intervention Analyst for the Board of Registered Nursing. I will be facilitating today's meeting. Today is Wednesday, October the 29th, 2025, and it is now 8:35 a.m. I officially call to order the meeting of the Intervention Evaluation Committee. The committee's purpose is to evaluate those RNs requesting participation in the intervention program according to the guidelines prescribed by the board, and to make recommendations to the program manager regarding the terms and conditions of the intervention agreement, including treatment, supervision, and monitoring requirements. Beginning with agenda item 1.0, roll call and establish the quorum. As I call your name, please introduce yourself and your role. Heather Hallmark.
Here.
Your role.
Oh, sorry. I'm here. My role is chair.
And RN member. Yes. Alexis Watson.
Hi, RN community member, vice chair.
RN member.
Harry Randazzo.
Hi, I'm I'm Carrie Randazzo. Oh, I do not. Wait a minute. Hi, I'm Carrie Randazzo, public member.
Please note for the record, Dr. Jason Barrett, physician member, is absent for today's proceeding. Thank you for the introductions. The quorum has been established at 8:37 a.m. Moving on to agenda item 2.0, general instructions for public participation. Board moderator, would you please share general instructions on how members of the public can participate during the public comment periods?
Good morning. This is the BRN moderator. I will be moderating the meeting. To facilitate public comment, we will be utilizing the WebEx question and answer feature, now known as Slido. When the committee reaches a point in the agenda at which public comment is appropriate, the question and answer feature will be turned on, and members of the public can indicate that they would like to make a comment by inserting the phrase, "I would like to make a comment," in the question box, which is typically in the lower right of your screen. I will then call on the individual and unmute their microphone. The individual will have 2 minutes to make their comments. I will not give a warning as your time approaches. I will mute your microphone and will announce that your time has exceeded the time allotted. I will then proceed to the next member of the public who has a comment. We will also query our in-person location. I'm sorry, where are you? What's your location? Are you here in the building?
Yes, we're in HQ2.
Okay, I'm sorry. We are in HQ2. Sorry, thank you. Please note that the question and answer feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. When your turn comes, you will be prompted to unmute. If your question can be answered, the committee will respond accordingly. When making your comment, please speak about anything you believe is important for the members to know. Remember, committee members cannot address any item not on the agenda. Items not on the agenda at that moment, items that you would like to add to a future meeting, or items that will be discussed later on in the agenda will be discussed at their correct times during the meeting. I will provide a brief reminder of this approach at the start of each public comment item. Finally, when committee members or BRN staff are not speaking, I would like to remind them to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will mute your microphone automatically.
We will proceed to agenda item 3.0, public comment for items not on the agenda and items for future agendas. Please note that the committee may not discuss or act on any matter raised during the public comment section that is not included on this agenda, except to decide whether to place the matter on the agenda of a future meeting. Board moderator, would you please open for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. Sorry, as we wait for the screen's slide to change. Okay, while we wait for the instructions, I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Sorry. Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Meeting facilitator Johnson, there are no public requests for comments on the WebEx. Do we have any requests for comments there in BRN HQ?
We do not.
Thank you. Would you like me to close this window?
Yes, please. Moving on to agenda item 4.0, approval of previous meeting minutes. Have all members had a chance to review the previous minutes? And are there any questions?
No questions.
No questions.
Do we have a motion?
Motions. Oh. Motion to accept IEC meeting minutes from July 30th, 2025, and allow BRN staff to make non-substantive changes to correct name misspellings and other typos that may be discovered in the document. I motion to accept this. Do I have a vote?
Do we have a second?
Second.
We need to open up for public comment.
Open for vote.
Open for public comment, board. Board moderator, please open for public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate if they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Meeting facilitator Johnson, there are no public requests for comments on the WebEx. We have no in-person representation there in BRN HQ. Would you like me to close this window?
Yes.
Thank you.
Before the committee votes, is there any additional discussion?
No discussion.
We would take vote by roll. When you hear your name, please vote yes, no, or abstain. Ms. Hallmark,
Vote yes.
Ms. Watson,
Yes.
Yes.
3 yeses, motion passes. Moving on to agenda item 5.0, information only, intervention program updates. Management continues to work with Premier Health Group, attending all intervention evaluation committee meetings, providing education to IEC members, and identifying possible gaps in regulation for the intervention program. The board continues to recruit IEC members with knowledge and experience in treatment of substance use disorder treatment or mental illness. To apply for an IEC position, please visit you can find an application on our website at rn.ca.gov/intervention. Board staff, in collaboration with Premier staff, is in the process of updating its outreach brochures and posters. The board emailed 345 outreach materials to individual nurses this last quarter period. This concludes the updates for item number 5.0. Moving on to 6.0. No, I'm sorry. Ms. Homer, would you please call for discussion?
For item 5.0, I call to discussion the intervention program updates, information.
Discussion here? None?
No, just.
No discussion.
We hear no discussion. You can open up for public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you'll have 2 minutes to make your comments. I will not give reminders as time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Meeting facilitator Johnson, there are no public requests for comments on the WebEx. We have no in-person representation there in BRN HQ. Would you like me to close the screen?
Yes, please. Agenda item 6.0, information only updates regarding requirements for participation and completion of the intervention program, including requirements of working in positions involving direct or indirect patient care and or furnishing or administering narcotics to patients. This update will be presented by our executive officer, Ms. Loretta Melby, on review of individual program participant requirements.
Thank you. So we'll give a little background. I've been coming into, sorry, I'll introduce myself first. I know it was just introduced, but I'm Loretta Melby, or Lori. I'm the board's executive officer. I've been the board's executive officer since 2020. And prior to that, I was a nursing education consultant for the board from 2014 forward. I am an RN, excuse me. And the board in August of last year asked me to start looking into the intervention program, doing a deep dive, trying to really respond to the public comment that was being heard at the intervention meetings, as well as nursing support group facilitator meetings, in our enforcement intervention and investigations committee meetings, as well as our board meetings. So they just kind of started coming in and really asking for some help. And so our board said, you know, Lori, we need you to go in and start looking at things and see what we can do. So we did that. We completed that. I gave an extensive report out in August last year at our board meeting that is available to watch on YouTube if that is something that you're wanting to do. But after that meeting is when the board said they wanted me to immediately start reviewing all of the IEC recommendations that asked for direct patient care, access to or passing narcotics for you have to do that in order to complete. The other thing that they wanted me to look at is anybody that was made to go longer than 3 years. Now, what I was looking for was not to overturn the request, but to see if there was evidence to support that. In the motion that the board made, they said that you guys could do direct patient care requirement. You guys could do a narcotic passing requirement if there was evidence of additional patient safety. So not what they came in with, right? So if they were released to go back to a direct patient care role and or start working as an RN in a non-direct patient care role, and you guys were getting additional complaints, you guys were seeing issues that were coming up that were problematic. So when we started having these conversations, I've now, thank goodness,
go to almost every committee. So by the time I go back in front of the board halfway through November, I will have hit all of the committees and have offered this discussion. I do plan to continue to come into these committees to provide any additional education. But what I wanted to do is, because I know that this has kind of gotten around, is to see if you guys have any questions or comments on that, to see if there is something that is concerning, something that you see that could hinder your practice, any confusion that you've run into. I can tell you that in the review process, when we first were asked to do this, I had 22 that I initially had to review. And I can tell you that from the August board meeting to now, I've only had one to review. And that shows me that the message is getting around, that you guys are hearing it, and that it is being followed. So that's promising. And the goal is at the November board meeting to actually ask the board to release me from doing this, that review process, and allow it to go through the typical process where Jaspreet, as the program manager, would do the reviews of all IEC recommendations. To ensure that there is evidence to support that. So I'm seeing my role with this come to an end, and I'm grateful for that. But I wanted to still come into these meetings and ask and see if there's anything that you guys need.
Thank you.
I just want to clarify, since I have not had enough coffee this morning as of yet, that the recommendations, since we're modifying the recommendations to fit each participant, such as if they came in with, we want to see before they go back, if they came in from diverting or something happened at the workplace, that's still within the acceptable range. Instead of like DUI, we're not going to have them, we don't need to see if they can pass narcotics, since that was never the issue to begin with. I just want to make sure this is, am I on the right train of thought?
Kind of. So I'll provide some additional guidance to that. If they're just coming in with diverting, no, that is not something that you would automatically say they have to return to direct patient care and pass narcotics in order for them to demonstrate safety. So I'll explain a little bit more with that. Your role as an IEC committee is to monitor their compliance with their rehabilitation process that you guys are orchestrating. And the reason that they're in this program is because their competency has been affected by their substance use disorder or their mental health. If they're working the program and they are managing their substance use disorder or mental health, then that was the only item that affected their competency. So as you guys are progressing them through the program, you start off with removing them from work, getting the drug test, getting everything established. Yeah, the support groups meetings, you've got their therapy, you've got their clinical eval, you've got everything going on. Then you guys are working with them, getting feedback from your clinical case managers, getting feedback from Vault, getting feedback from everywhere that you can get. And you guys say at that point, I believe they can start working again as an RN, but you don't want them in direct patient care. So you put them out as an RN, but not in direct patient care. And then you guys continue to monitor them. And you have your work site reports, you have your drug screen, you have everything that you're needing to continue this evaluation. And at that point, you can say they can go to direct patient care. We can't make them go to direct patient care. There are many, many times that diverting occurs even when they're not in a direct patient care role. There are many times that other items occur. Take for an example would be like say you have a pharmacy tech, obviously not in our program, but they have access to medications as part of their job. They're not doing direct patient care. So it's not about managing the access to the medication. It's about managing the addiction or the mental health issue that's causing you to want to access the medication and use it for a reason to cope, to manage your anxiety as a release. So if you're able to manage the substance use disorder or the mental health issue, that desire to do that is now managed. We know that that's never going to go away. It's typically, addiction is lifelong. And we do not see sobriety where you really understand that this is going to stick for 5 to 8 years, and our program is 3 to 5 years, right? So when you look at all the statistics around that, we're never going to have them in our program long enough to say affirmatively, you are good, this will never happen again, which is why when they're able to successfully complete, we leave them with the tools and ability to come back into our program in case they need additional help in the future. Because again, 3 years, they're not guaranteed to be sober for a long time. 5 years, they're not guaranteed to be sober for a long time. The statistics don't start showing that until 8 years, and we don't have them in our program. So with that, you can progress them, you can watch their progress in our program, and you can give them that ability to have more access. You can say they can have a direct patient care. Excuse me. You can say that they can go in and pass narcotics and have access to narcotics. But if you've got somebody that's been a case manager for 20 years and they were able to divert because they were doing case management at a hospital and they were able to grab something, pick something up, get access to something, you don't want that person to be forced into patient care. They've not done patient care in 20 years. The competency risk is greater having them go in and work in an environment that they're not competent in. Additional things to take into consideration with that is you would probably have to have a new to specialty program that a hiring manager would want to take them into, because again, they would have to be trained. You would also have to have a workplace that would be willing to bring them in on a temporary basis, because usually if you've been a 20-year case manager, you're not planning on staying in direct patient care. So they're going to go in and they're going to interview and they're going to say, I need this just to complete my intervention program. Coming from a hiring manager perspective, that is almost impossible because of the money that has to be invested to train that person into a new to specialty role, get them competent, and then get them out into passing narcotics. So that's like the logistics part of it. But the mental health and substance use disorder part of it is, if part of their recovery, they know their limitations is not to have access to narcotics, us forcing them to do that is against their rehabilitation plan. And so that is not something that we want to do, unless, again, and that's the caveat that the board put out there, that there is evidence that there is a patient safety risk. And so say you've released them back to be an RN and you've released them back to be even direct patient care, and they've decided they want to go and do that, and they're starting to miss calls. They're starting to have some suspected compliance issues. They're not going to all of their meetings. They're starting to just kind of fall off the wagon. They might not be off the wagon yet, but you're noticing these things that are saying to you, this person is not using their tools in the way that they should be. That gives you some concern. But then you also have to look again at your individual person. You are not going to be able to predict their future. And so you are able to use as much as the information that you have in front of you to reasonably come to the decision that they can practice safely. I'll use an example for me. I've been the EO now for 5 years. I was an NEC here for 6 years prior to that. I've been out of direct patient care for greater than 5 years. I'm not competent to walk right into a unit today and start doing this. But I may have plans in the future where I want to keep my RN license. I want my options open. I'm young enough. I could return to practice if I chose to. But to have this a condition for me to complete, unless you have evidence to say that you really believe that I'm going to be at risk to the public, then if there's no evidence, we can't put that forward. We'll put it back to the IEC to reconsider. And reconsider does not mean don't go forward with it. It might mean find additional evidence. if you guys are very firm in that this is something you need to do, you really have that feeling, then you've got to find the evidence behind that to support that. Because if it comes forward and there's no evidence, we have to kick it back until there's evidence. We've also had some incidences on review where they've had some pretty significant medical concerns, where they're not able to go into direct patient care. Medically, they're not able to put that strain on their body, and that's different from their mental health disorder. That's different from their substance use disorder. We need to take those kind of things into consideration as well. An RN license is not a direct patient care license, right? An RN license means that you have the scientific knowledge and skill in order to practice safely and in any position that you choose to go into, not just direct patient care. And then on the side note with the narcotics is we tend to use the term access to narcotics. It is very evident in medicine that narcotics are not the only addictive medication out there. It's not the only it's not the only medication that causes an altered sense of reality or even in any kind of impact to the chemistry of the brain. And so when we use a term like access to narcotics, we're truly not inclusive of everything that is going on. I mean, I could go and take a bunch of Seroquel, which is not a narcotic, and I'm going to have an amazing effect that if I was an addict, that might be something that I am chasing. That's something that I want. That's not a narcotic. And so by limiting it to access to narcotics, that also limits your ability to be able to manage them through their recovery as well. So hopefully I've answered some questions. If there's more questions, please continue to ask, and I'll continue to do my best to try to explain.
And that's it on my end.
Thank you.
Are there any other questions from the committee?
No.
Nothing? Okay, I will be back in front of you guys, probably your next meeting. So if something comes up in between, feel free to reach out, or if it's something that's not urgent or anything, we can save those questions for when you're back in front of, and we're doing this again. So thank you guys for your time. It is 9 o'clock. I want to be mindful of that so you guys can start your meeting on time. Thank you.
Thank you.
Thank you.
Thank you.
Board moderator, will you please open for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you'll have 2 minutes to make your comments. I would like to give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Meeting facilitator Johnson, there are no public requests for comments on the WebEx. Would you like me to close this window?
Yes,
And sorry, we have no in-person representation in BRN HQ.
correct. Yes, you can close. Thank you. Moving on to agenda item 7.0, discussion and possible action. Review IEC member guide and intervention program regulations, California Code of Regulations, Title 16, Sections 1446 to 49, and provide recommendations to the board. Board staff requests intervention members to review the IEC guide on an ongoing basis and offer feedback to staff regarding any areas where information could be developed further. Board is responsible for onboarding and training all of IECs to ensure members are successful in their role. The board is seeking feedback from its IECs on a regulatory changes that will help the board better fulfill its legislative mandate. IECs are responsible for evaluating registered nurses in the program according to the guidelines prescribed by the board. Those guidelines, which can be found under California Code of Regulations Title 16, Sections 1446, 49, currently pertain to admission criteria, procedures to review program applicants, causes for denial of admission, causes for termination from the program, as well as other requirements. Chair Hallmark, would you please call for any discussion?
I call for discussion for item 7.0. Do we have any discussions among the committee? No.
No.
We have no discussion. We can open up for public comment.
Board moderator, would you please open for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I would like to give reminders your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Meeting facilitator Johnson, there are no public requests for comments on the WebEx. We have no in-person representation in BRNHQ. Would you like me to close this window?
Yes. Moving on to agenda item 8.0, approve proposed 2026 IEC meeting schedule. Each committee meeting must have a quorum to comply with requirements to the Bagley-King Opening Meeting Act and to review registered nurses in the intervention program. Historically, IEC meetings have been held quarterly. To better meet program needs, staff proposed increasing number to 6 meetings in 2026. The proposed schedule considers upcoming board and committee meetings as well as state holidays. The committee is asked to review and adopt a 2026 IEC meeting schedule, which was provided. Have all members had a chance to review the proposed IEC meeting schedule?
Yes.
And are there any questions?
Not at this time.
No, that's fine.
Do we have a motion to approve the proposed 2026?
Motion to approve.
Seconded. Move to vote.
Board moderator, would you please open for public comment?
Sorry, we will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Meeting facilitator Johnson, there are no public requests for comments on the WebEx. We have no in-person representation in BRNHQ. Would you like me to close this window?
Yes, please. Before the committee votes, there is no additional discussion. You don't want to discuss. We have a motion by Alexis to approve the proposed 2026 IEC meeting schedule. We will take vote by roll call. When a member hears their name, please vote yes, no, or abstain. Chair Hallmark,
I vote yes.
Ms. Watson?
Yes.
Ms. Randazzo.
Yes.
Motion passes 4 yes. Moving on to agenda item 9.0, the committee will meet in closed session pursuant to Business and Profession Code Section 2770.10 and Government Code Section 1126 Subdivision C2 to discuss and vote on matters related to the intervention program, applicants and participation. This meeting is recessing to go into closed session at 9:10 a.m. Open session will reconvene immediately following closed session.